your name, where you're from, and what you do in the States.
I'm Ryan. I'm from Denver, Colorado, and I work as an emergency medical technician.
And I'm Charlie. I'm also from Denver, Colorado, and I work as a certified nurse assistant.
Okay, so why did you choose to volunteer in Tanzania, and which project did you volunteer on?
Well, I think we chose to volunteer in Tanzania primarily because of the healthcare crisis that is happening here. We found some pretty staggering statistics in our research and planning, primarily that for every 50,000 patients there's one doctor in the country, and we felt that this was a place that we could come and hopefully help out.
And so as such, we decided to do a medical volunteer trip. So we've been volunteering at St. Hospital, utilizing some of the things that we know and practice in our jobs back in the United States.
Can you tell us a little bit about the volunteer house and the accommodations and food?
The volunteer house has been awesome. It's a great house full of volunteers from all over the world, and I think for most of our time here there's been 3 volunteers here with us, and we're able to live with some guys here who live locally, and they've been able to kind of show us around town and really be here to help us with whatever we need. And I think it's been really allowed us to make close relationships with some of the people here.
Yeah, it's really been the thing that's kept us going and motivated and welcomed here, and Karibu Sana. We got to hang out with our new Kaka Edie and some of our friends from other countries and other cultures, and it's just sort of put the cherry on top of a great experience here in Arusha.
And the food's been really good.
Yeah.
We've had really good home-cooked food, lots of protein and carbs, and they've been very attentive to proper nutrition for us here.
Keeping us nimasiba sana.
Okay, can you tell us what the most shocking part of Tanzania is, and what was the best or most rewarding experience of volunteering in the hospital?
I think the most shocking part was just seeing the level of poverty here. Interacting with the patients at St. Hospital and just the locals in the communities surrounding us here in Arusha has been pretty eye-opening. It's really the true force of the poor in the world here.
And the most rewarding part was helping those people out medically and seeing the looks on their faces and some of the words that maybe we understood of appreciation for having somebody from another country coming to build a relationship and show that we care about them and their health.
All right, so do you have any advice for future volunteers?
I would say just come with an open mind and be prepared to have some culture shock. Come with supplies that might help the local people here. Particularly for us, it was related to the hospital and bringing medical supplies, particularly hand sanitizer or other basic things that are really useful and really appreciated here.
And do your research ahead of time, learn a little bit about the culture here, maybe learn a few words in Kiswahili, and yeah, just keep an open mind and realize that you're not going to make wholesale changes or change everything that's happening here in the country, and just sort of try to assimilate into it and learn what you can and help out where you can.